Hello, everyone, and welcome to Medical Insight. My name is Dr. Andy, and Happy New Year of Completeness to you. Today, we are going to be tackling a subject and a topic of interest, especially to the married couple. We are talking all things contraceptives. What are the options that are available to you from hormonal, surgical, mechanical, and preventative methods that are available for you out there? And today we've got Sister Mahlalela Nkosi, who spends over 13 years of working experience to shed more light on the topic. But before we get a chat with her, watch this video that is going to show you what is available on the market.
With half of all pregnancies unplanned, we can all do a better job helping patients to choose the right contraceptive. Today, we have access to more methods than ever, and you should be able to help your patient navigate the options and find the right fit for her. Contraception can be broken down into reversible versus irreversible and 3 categories of efficacy. The least effective have failure rates over 12%. Spermicides, fertility awareness, withdrawal, sponge, diaphragm, and condoms. These may be the right choice if an unplanned pregnancy wouldn't be a health risk. All are reversible. The effective methods have failure rates between 3 and 8%. These include daily oral contraceptive pills, weekly contraceptive patch, and monthly vaginal ring. All of these contain both estrogen and progestin. Injectable progestin is given every 3 months. All of these methods are reversible. The most effective methods have failure rates less than 1%. Tubal ligation and vasectomy are surgical procedures that are permanent. Copper and progestin-containing IUDs, or intrauterine devices, are inserted into the uterus and are reversible. Not all contraceptive methods are appropriate for all patients. Patients need to understand the risks and benefits of each method and decide which is best for them.
And joining us to tackle all things contraceptives is Sister Mahlalela Nkosi, who spends over 13 years of working experience. Now, Sister Mahlalela, welcome to Medical Insight.
Thank you.
I understand that on your day-to-day basis, this is what you work with: injecting, inserting implants, all things family planning. Mm-hmm. But before we get to the topic, can you tell us a little more about yourself?
I'm Sharon Mahlalela Nkosi. I'm working as a school health nurse in Tshwane. Mm-hmm. So basically, I'm youth-friendly nurse.
Yeah.
In terms of family planning, contraceptive, lifestyle, motivation.
Yeah.
Yes.
Awesome. So now we are talking perhaps to the couple that's recently married and they are planning. They want to know when to have their first kid and so forth. And they're trying to consider the contraceptives that are available to them. Why does a couple need such counseling, for example?
Thank you so much for that question. It's very important couple to do family planning while they are planning their future. They must not do it haphazard. They must plan so that life for them, it will be flowing. Remember, when you do children without planning, it involves financial it involves emotionally, it involves time for them to support these coming kids.
So it's not just about...
You don't just do haphazard.
Yeah.
So the first thing couples need to know, first their status.
Yeah.
Also, they check their status, both of them, mm-hmm. and then they decide how many years to come for them to have children.
Yeah.
So family planning is very important when you start. It's not like when you get married, you need to just pop up kids.
As society
Yes,
often expects of the married couple. But before we get into the different contraceptives, I understand there's hormonal, there's barriers, there's surgical. Let's look at the body at puberty. For the male, as soon as they start producing testosterone, sperm production is activated. And for the male, this continues until their old age. But for the woman, the fertility process is marked by menarche and menopause. So what is menarche?
With menarche, with can you reverse? Wait, conjugate.
Menarche, when you start ovulating, menstruation. Yeah.
Okay.
No, you can just answer.
Okay. With menarche, we look your time frame of period are not the same. Others they can go three days, other can be 7 days. It's normally 7 days. You don't go further than that. So then if it's further than that, you need to see a gynecologist to see there's something that is not balanced there.
Yeah, so basically you're saying that if your cycle goes beyond 7 days, then it is not what is expected within the normal limits.
Yes.
Okay, that's fine. So now tell us about what contraceptives are available.
There are so many. Others, they are used in private. In government, there are few of them because budget-wise.
Okay.
So there are a lot. So it depends on the finance of that person to go with family planning. So, like, I will introduce.
But I also understand it's not just finance. Sometimes
finance.
Medical conditions as well that the person has in terms of deciding
50-50. I would say 50-50. There's one who don't want injection.
Okay.
So they can use. I will talk about the hormonal one now.
All right.
Hormonal one will use the patch,
Okay.
which you put for 7 days. You remove it. Those ones, it's 7 days. It's money costing, and in the pack they are 7, and you keep on renewing the scripts.
Okay.
You see, basically that's why I'm saying
there is financial
implications.
Are they available in government?
No,
the patches?
they're not available. Even the fem cap, it's not available.
Okay.
The fem cap, it's like a device. It's a device that you put on. It's like the one for female condom.
Yeah.
You know the female condom, you put it.
Yeah, it has a ring around it.
It's a ring. Yeah. This one is like a scoop.
Okay.
So
it sits on the cervix.
Yes, it sits on the cervix. Okay. Let me say the hormonal one.
Yeah.
We have the injectable, which will be a Nourish Straight and the depot. And we have the pill. With the pill, we have a Nodet and Trifasol and micro ova.
Okay.
They are different. And then 3 will have the device.
Okay.
With the injectable, we preferable for those ones who just starting.
Okay.
Never been pregnant. For Nourish Straight.
Okay.
It's good for them. But depending hormonal if it's working for them, because it end up having side effect of maybe they will spot due to hormonal.
So if one is on nurse steroids, which is the 2 months when they can expect to have spotting as a side effect.
Yes.
Okay.
And then the depot, it's for those ones who breastfeed and also who already have kids.
Had children.
Yes.
Okay.
So then there is the pills one.
Yeah.
The pills one, those one. Now for me, when I say this pill, it's good for you, the person must remember the dates and time.
Okay.
Or using the alarm.
Okay.
And then that person also, those person that will say, I want to see my period.
Oh.
I want to see, because if they don't see their period, they will I feel like I'm not normal.
Okay.
If I don't see, give me it.
Okay.
It's a myth. Because we put those, we give those in pills so that we tell the hormones not to produce a periods.
Yeah.
You understand? So with those one, the depot, then sorry, the no debt.
Yeah.
No debt. You drink it for 28 days with the period. Also, you
Yeah.
have the periods.
So, with the, say somebody wants to consider using oral contraceptives, at what point do they start? When do they come to you? If they are there on their cycle, when do they start to drink? Because the pills are like on the 28th cycle, and then you get the placebos also. So, when do they start to drink?
When if we don't have the sample, we are supposed to show them.
Yeah.
But on the container,
Yeah.
it shows dates.
Oh.
When to start.
Yeah.
But preferable, a person must be on period.
Oh, so that's like day one of their cycle.
It doesn't matter.
Okay.
But they must be on period.
Okay.
So that it will work best, because you cannot start a person which you don't know where is he pregnant or not. And also you test for pregnancy test.
Yeah.
Some pregnancy tests they don't show immediately. It depends which one you use.
Yeah.
There's one for 10 rand, there's one for 30 rand, there's one for 100 and something that will show you how many days.
Yeah.
So when you come to me as a professional nurse, I will start checking if your period, how many days are you?
Yeah.
And also,
So that's part of the history taking that goes on before deciding, which contraceptive to use.
Yes.
Okay.
So with a government, they produce 3 ones, but there's more outside the field.
Okay.
So those ones, Nodet and Depot, not Depot, it's Nodet and Trifacil and Mycoval and Oval.
Yeah, those are the different kinds of oral
that you get
contraceptives.
cheaper, easily, free.
Okay, and all of that information is available during the consultation.
Yes.
All right, thank you so much, Sister Sharon. We are going to take a break at this juncture, and when we come back, we talk more on the various options that are available for you as far as contraception is concerned.
You've heard the testimonies. You've seen the demonstration of the supernatural. But you haven't watched it told this way. Do you believe in miracles? Updated edition.
You're free from it.
A classic compilation of outstanding miracles, healings, and transformations. Relive the unforgettable meetings where lives were changed in moments.
Do you believe in miracles? This is an updated edition, so you can get it for yourself.
Do you believe in miracles? Updated edition. Now available on the Pastor Chris Digital Library. Get your copy today. Also available on other video formats. To place your order, please call the number now displayed on your screen. Hurry now.
He loves you and wants you well.
Welcome back, ladies and gentlemen, and you are still tuned into Medical Insight. Today we are talking all things contraceptives. You know, for the married couple, just because they are married may not mean that they are already ready to conceive. And today's topic and today's show, it helps us to know what contraceptive options are available out there. Sister Sharon, before the break, you mentioned some of the hormonal options, right? And you also mentioned a device. Can you shed more light on that?
Sister Doctor, with the device, we have a the copper one.
Yeah.
With the copper one, with the copper one, it has criteria.
Okay.
Criteria based on conditions.
All right.
Not everybody will get the copper.
Yeah.
chronic HIV, they need to be taken history before they put the copper.
Yeah.
And then we have the new one we call Mirana.
Okay.
Mirana, it takes all hormonally changes in balance. So, but with that one, criteria, it's the measurement of the cervix,
Okay.
the measurement, the size.
Yeah.
We are not in one size.
Okay.
So basically, to be approved, you must be 5 centimeters and above
Okay.
when you put Mirana.
Or 5 centimeters of
And
what?
Centimeters of your cervix.
Oh, the whole cervix.
Yeah, because you just get in and
Yeah.
then you find that it is obstructive.
Oh.
So you can't put because
Yeah.
it needs a space and flip.
Okay.
Even both of them, they need the
The
measurement.
surface area.
Yes.
Yeah.
And then also we have the implant.
Yeah.
The implant is the one that you put.
Yeah.
It takes 3 years in you.
Yeah.
It's not even painful when people they
Yeah.
are scared. It's like, just imagine taking, how many injections would you take when 3 years, in 3 years, than one injection
Just
once
one
off?
implant. Yeah.
You understand?
So take us through, because I know that you insert these implants almost on a daily basis as part of your work. The procedure, the actual procedure, how do you position the patient? How do you numb them so that they don't feel the pain? You know,
Okay, with the procedure,
yeah.
one, you use in the index hand. If you are using this hand to eat
Yeah.
or to write, you put on the
Non-dominant hand,
non-dominant
basically.
hand. So with a non-dominant hand, you must lie facing up, and then we do a measurement of 8 to
Yeah.
4. You do 4, and then you take 4 centimeters also.
Yeah.
That's the measurement. From this bone,
Yeah.
it's 8.
Yeah.
And then also from 8, it's where you're going to inject.
Yeah. You add
And
another, basically
it is-
12 centimeters.
Yes, 12
Yeah.
centimeters. So you numb with the lipnocaine.
But the numbing part, they should feel a little bit of pinch, because that's the first needle that you're going to inject.
We use the smallest
lignocane.
one because we know they're
But they will
scared.
feel a pinch of some sort that you are
It's a
working on it.
pinch, not-
Yes, it's a needle on skin.
It's not that bad.
Yeah.
Than the one that you'll get every 3 months.
Yeah.
So you need to be strong
I mean, it's just
for your
the-
safe of not getting pregnant.
Okay.
So when we numb the hand, and then we insert it.
Okay.
And then when we insert it, you open the bandage after 3 days.
Okay.
And in that part, you'll turn greenish,
All right.
other black. You don't need to
Worry about.
about it. It will, after 2 weeks,
Yeah.
all this, it will go away.
Okay. So I know women, they go on their cycle monthly. But now you mentioned all of these hormonal contraceptives. With the pills, they can expect to go on their cycle.
Yes.
With the implant,
With an implant also, it's a 50-50.
okay.
But when it's happened, we tell the person to come to the clinic to control.
Okay.
We give extra pill for 14 days to control the hormonal imbalance.
Okay.
Because-
Does that mean the hormonal imbalance can cause them to overbleed?
Yes.
Okay. So it's one of the things they sort of can look out for
Yes.
as soon as they have the
Yes,
implant.
it's the breakthrough bleeding,
Yeah.
spotting.
Yeah.
Others, they will experience headache, rash, but those things you can live with. It's not
It's not
a major
life-threatening.
one. Yes, life-threatening one.
Yeah.
So you can come to the clinic. Some you cannot control, but it depends on your goal also, because it will be the headache. It's like hormonally, like when you go on your period, you feel your breasts,
Breast changes.
breast changes or tingling. You see, it's those moments, not every
Yeah.
the whole of the implant. You will feel like this. It will be once off in a month, once off in a month.
Yeah.
So like you can live with that.
Then you mentioned with Nosteroids, which is an injectable and is injectable at every 2 months. You mentioned that usually that is considered for nulliparous people that haven't conceived or haven't fallen pregnant before. The implant, who is it more considered for?
Anybody can go for implant. It's
Yeah.
hormonal.
Okay.
It's like using the patch,
Yeah.
but patch is expensive. We cannot afford at the clinic to
Yeah. So what are the places where one can go to have an implant inserted, for example?
To insert implant.
Yeah.
We use this part of the.
Or I mean, like places, GP clinics, gynaes,
Yes,
all of those.
them.
But okay,
Yes, but at the
That's-
clinic it's free.
it's free of charge. Awesome. So now that you've exhausted all of these hormonal, what other contraceptives are there?
No, as I said, there are lots. There are lots, but they are also doing the same.
Yeah.
It depends because people, they value their time. They don't want to be at the clinic. So at the private sector,
Yeah.
they provide PESH, Fem Cup.
Yeah. Let's talk about the barrier methods. The
barrier.
condom. Yeah.
The condom. I love the condom, ne?
Yeah.
Because the condom.
Most sisters do.
I do love
Yeah.
the condom because I call it 3-in-1.
Yeah.
3-in-1, HIV
Yes.
protected, STI protected. Children, you
Yeah.
plan the way you want it.
Yeah.
So those are the burial methods that
Okay.
you can use.
Yeah.
But condom is the best.
Yeah. I understand there's the male condom and the femidom. Yeah. So what's the difference between the two?
The difference with the two, it's
The structure.
The structure. It's only the structure.
The other one is designed for male. The other one is designed for female.
Yes,
Yeah.
the structure only, and the procedure, how to
Yeah.
insert it. That's how
Yeah.
people get it to be difficult for them.
Yeah.
So, but they are the same. It depends how comfortable you are.
Yeah.
Yes.
Okay, awesome. And I like that you highlighted that it's also a prevention method for sexually transmitted infections, HIV, and of course, it serves as a barrier.
Serves as a
method.
barrier.
Yeah. Now let's talk about the surgical preventing methods.
The surgical one.
Yeah. Like
It will be the tubal
ligation.
ligation, and also what do you call
Vasectomy.
vasectomy
Yeah.
for male.
males. Yeah.
Yeah, but we so wish government can provide the male also to get family planning.
Right.
Yes, methods.
So, tell us about the tubal ligation. Tubal ligation simply means that the tubes, the fallopian tubes,
They
will
are
be
closed.
tied off.
They will be
But I
tied.
understand not an nulliparous woman can have that. Okay.
Yes.
All right. And then, so what exactly happens? So it means that the woman needs to have at least given birth for them to consider that option. Is it 100% safe? Can I just go tie my tubes?
With the lubrication age, it's a criteria in government, but if you are in a private sector,
Yeah.
it's your right. You use it the way you want it.
Okay.
With us, there's a criteria.
Okay.
It depends on how many children do you have.
Okay.
Not one, not two, not three, then even the age count.
Okay.
So you cannot be at above 40 and you.
So if you're above 40
Yeah,
in
above
a public
40
facility, they will not consider.
Yeah.
Okay.
And the chronic also, they look at your chronic issues.
Chronic conditions.
Yeah, conditions.
All right. And the vasectomy?
Vasectomy, it's couple decide.
Okay.
They decide and it needs both of them.
Yeah. Like
To-
we said at the beginning of the show that this is not a woman's talk. It's a couple's, it's a
couple,
together.
yes.
Yeah, it's a
You
together
decide.
conversation. Yeah.
With government, it's a criteria. With public sector,
Yeah.
you decide.
With
and
the
they
private sector, yeah.
Yes, or you freeze your eggs. Then you later on,
Yeah.
you'll use them.
So there's a lot of options
There's
out
a lot of options that
Yeah.
we can talk about
Yeah.
it.
And I
So-
just want to mention, just for those that are at home, what actually happens when one is having a vasectomy. So they also, male also have these tubes that carry the sperm from the testis into the urethra. So it's the testis, and then it goes to form the epididymis, and then the vas deferens, which is the tube that actually carries the sperm body. So what they do is to cut off that vas deferens and tie it so that the sperms will still be produced, but they will just not be delivered to the urethra.
Because some couple worry about the sperm. It's a myth.
Yeah.
The sperm is there, but it's not having that the semen to produce.
Yeah.
Yes, that's the only thing.
The semen is there, but not the sperms.
Not the,
Yeah.
to produce.
Yeah.
So
okay. And is it also 100% safe, or there's a chance of falling
99,
pregnant?
all contraceptive, 99%.
Yeah.
The tube can, and then
Regrow.
it regrow. Yes.
Yeah, it's a
Yes, it's a
possibility.
possibility.
Yeah.
Even also to women also.
Yeah.
You find one
Regrows.
regrows.
And reconnects.
Yes, so don't blame one another and say, nah, I closed. Then you need to go and check as a couple again what is
Yeah.
happening.
Yeah. And you did mention, I think also the discussion of Pearl Index also comes in when you guys cancel the couple. And you spoke about that no contraceptive is
100%.
100%.
No.
Yeah. Tell us about, when we talk about contraceptives, we also talk about the Pearl Index. What is a Pearl Index?
With the Pearl Index, we talk about the criteria of a contraceptive and HIV status. It's a stats. What is happening on implant? What is happening on HIV? What is happening on the device?
It's the measure of how
effective. It's like your feedback after putting it. How is it for you? It's a sort of a research that is
carried out to show
Yes.
how effective a contraceptive
Contraceptive
is. There you have it, ladies and gentlemen. I hope that you found today's topic quite enlightening and thought-provoking. Until our next episode, stay tuned.